Brock University acknowledges the land on which we gather is the traditional territory of Haudenosaunee and Anishinaabe peoples, many of whom continue to live and work here today. This territory is covered by the Upper Canada Treaties and is within the land protected with Dish with One Spoon Wampum Agreement. Today, this gathering place is home to many First Nations, Métis, and Inuit peoples, and acknowledging reminds us that our great standard of living is directly related to the resources and friendship of Indigenous people. Good morning and welcome to this session of Business Breeders, a live webinar series hosted by Goodman Group at Brock University. My name is Abdul Rahimi and it's my distinct pleasure to serve as the Director of Goodman Group at Brock University. Goodman Group is a community-focused learning and development services provider that works to support professionals, businesses, and entrepreneurs pursuing growth through professional development certificate programs, executive education, consulting services, and startup support. It is my distinct pleasure to welcome you all to today's session as you take a break with us. This webinar series aims to provide 45-minute breathers filled with insightful discussions on timely topics that are relevant to businesses and everyday lives. And these are led by our award-winning Brock University faculty members and leading industry experts, all of whom encourage thoughtful debates, keeping us all feeling connected as we get through this. In a moment, I will introduce our distinguished speaker for today's session. And thank you to all of you who have already submitted your questions at the time of registrations. And for those of you watching us live, feel free to type in your questions into the chat feature, which is open now. Now, it is my distinct pleasure to introduce today's webinar lead. That's Lynn Guerriero. Lynn joined Niagara Health in February 2020, just before the pandemic was declared, and has managed all aspects of the hospital's accountabilities related to the pandemic response, including all Niagara region assessment centers, management oversight of 2 long-term care facilities in crisis, and vaccine administration. An accomplished leader in Ontario healthcare system, she has more than 30 years of leadership, management, and clinical experience with a variety of healthcare settings, including provincial, government, agency, acute care, rehabilitation, and community care. Lynn is known for her expertise in providing positive leadership in large, complex environments, leading to progressive improvements in healthcare practice and performance. She has a deep understanding of how an integrated healthcare system would benefit patients' care, as well as a strong commitment to providing patients and families with extraordinary caring in every aspect of their experience. Welcome, Lynn.
Thank you so much, Abdul. And thanks for having me today. I'm really appreciating the time to discuss something very near and dear to my heart, that being leadership amongst very difficult times in healthcare. Just a little bit of a summary of today's discussion, just 3 objectives really, to bring us into a little bit of an understanding on the situation that existed when I joined Niagara Health, as Abdul mentioned, in February of 2020, how the pandemic influenced my approach to leadership, taking on a very new role, and then just a summary of key considerations and character traits that were necessary for successful leadership at that time. So just to set the context, a little bit about Niagara Health. For those not familiar, we are a 5-site hospital with sites in St. Catharines, Niagara Falls, Welland, Fort Erie, and Port Colborne. So quite a large organization. In fact, we're one of the largest employers in Niagara with more than 6,000 employees. If you go to the next, Allison. Some key facts. We're also one of the largest community hospital systems in Ontario, and we do about 30,000 surgical procedures and over 500,000 ambulatory visits annually. So it's quite a large operation. And in fact, we have the 4th largest emergency department in the province, considering all of our sites. So just a sense of how big the organization is and how complicated it is across 5 sites. So bring us back to the beginning of the pandemic and a little bit of context with respect to when I started this new job. So we'll go back a little bit. The first cases of COVID-19 were diagnosed in China in December of 2019. And you can see the timeline here. At the time of that sort of emerging cases in China, I was an assistant deputy minister with the Ministry of Health, actually, just before coming to Niagara. And in January, we began to closely monitor the worldwide situation and prepare for the first cases to arrive in Canada. I say that very deliberately. We knew it wasn't a matter of if, but when and where we would get cases. So I was very closely attuned to what was going on worldwide with respect to the pandemic, given my prior role. There was still much unknown about the virus at the time and its transmission. The first cases were diagnosed in Ontario shortly before I left the Ministry of Health, but there were no cases in Niagara. So I started at Niagara Health, you can see there, as president on February the 18th of 2020. By that time, more cases were being diagnosed in Canada, and shortly after my arrival, the daily case counts outside of China surpassed those inside. And exactly 3 weeks after my arrival, the World Health Organization declared the pandemic. So I had 3 weeks to learn everything I needed to learn about Niagara Health. This is a slide that shows a little bit of the snapshot of what was happening at the time worldwide. So I was wrapping up my role as ADM, as I was wrapping up my role as ADM, Niagara Health was preparing for a big change in leadership with my arrival. This is the activity we were seeing with COVID worldwide at the time, and cases were building. There was a few cases in Toronto, but as I mentioned, none yet in Niagara. So this next slide is interesting, Allison, if you can go to the next, thank you. So as with any new president, of course I had a 90-day plan for how I would start this exciting new job. This was and still is my dream job, and I had always wanted to return to hospital-based healthcare to finish out my career. For the most part, right, 90 days, listening, learning, meeting key leaders within the organization, key partners outside of the organization, thought leaders in the Niagara community. That was my 90-day plan, listening and learning. And given how extensive my job is, my onboarding plan actually spanned about 9 months. So prior to starting, I had agreed to an onboarding plan that was quite lengthy. I was staying in an Airbnb at the time in St. Catharines. We wouldn't move into our new home until April of 2020. So new to a massive organization, first time as a president, first time reporting to a board, and a newcomer to the region. That's sort of how things started. So I spent my first 3 weeks meeting as many staff and physicians as possible. So these pictures were taken last part of February and first part of March 2020. And you can see how close together we are, no masks. I probably shook hands with over 1,000 people in those early days. You can see even in these pictures, we're touching and have our arms around each other. It's interesting to look at these pictures now. I traveled to each site, thankfully, so I was able to get to every site and visited pretty much every unit. Keep in mind that healthcare professionals are on the front line, and you can't just hold a meeting, right? Since they're focused on providing patient care, you can't shut down patient care areas to have a staff meeting. So face-to-face interactions are especially valuable and important. In getting to know the team, you have to go to them to get to know them. So I was able to visit every site. I had 2 executive team meetings, and I had the opportunity to attend my first board meeting in those first 3 weeks before the pandemic. Needless to say, those plans came to a screeching halt with the arrival of COVID-19 in Niagara and the urgent need to really change and adapt a leadership approach, and really an approach to providing healthcare in the region, to respond to what really became a really unprecedented global crisis. So if you could go to the next, Allison. So in the middle of my 3rd week, the World Health Organization declared COVID-19 a global pandemic. And although there were no confirmed cases in Niagara, we had been closely monitoring the situation and preparing for the pandemic crisis response that we would eventually have to undertake. So you may wonder how hospitals actually prepare for things like this. All hospitals actually have an emergency operations committee. So that is a group of people that is very easily struck in any emergency situation. It could be a mass casualty event. It could be, the hospital floods or something. In this case, it was the pandemic. So key leaders within the organization with very specific roles to play in an emergency situation sit on that group. Ours started meeting daily in the weeks leading up to the declaration of the pandemic, so they had gotten used to that cadence. That group, interestingly, continues to meet regularly now after 20 months. During the various waves of the pandemic, that group met anywhere from daily to weekly. Right now, we're at a weekly cadence. Every single decision about the response would go through that committee, and that committee would also include the entire executive team, such that decisions can be made and changed daily, sometimes more than daily, without having to go through multiple layers. So there has to be a very, very quick response. Difficult decisions that require sort of an in-camera conversation with the executive team would also occur, And during the first 3 big waves, the executive team was meeting daily as well, sometimes more than daily. So essentially, if you think of that cadence, all other business stopped once the pandemic was declared, and we were solely focused on our response. If you go to the next slide, Allison. So our first case in Niagara was March 12th, a date that's embedded in all of our brains. And that patient arrived at the St. Catharines site for testing. And a few days later, we had emergency orders from the government that directed hospitals in Ontario to ramp down all non-urgent surgeries and all ambulatory procedures to ensure we were prepared for the large numbers of patients that would arrive at our doorsteps. So you can see here the timeline of what was happening in Niagara specifically at the time. And, you know, this was an unprecedented crisis in healthcare and in the province in general. So change was occurring at a very rapid pace, and we could essentially barely go to sleep. So those early days, we were only sleeping when we had to, I would say, in the middle of the night, and otherwise working. Anything that could be considered normal really went out the window. So when you think about that, it was quite necessary for my leadership style to adapt very, very quickly. I would recall going to bed at night, sitting in my little Airbnb, having had no time to actually think during the day. You're really just reacting. And lying in bed thinking, well, this is the biggest test of leadership that I will ever experience. And the weight of that in the early days before I got to know my team was almost overwhelming, I would say. Luckily, that feeling went away fairly quickly as I got comfortable with the team. In order to have an effective, coordinated response and meet the needs of our patients, we needed all team members to do their jobs, of course, to the expert level that they always do, but to also follow directives from a chain of command that was pretty specific in order to deliver the best care that was safe and effective. That was also based on the best available evidence at any given time, right? So directives were changing, the evidence was changing, sometimes more than once a day. So the team had to be mobilized to do their jobs, do them really well, and change on a dime, given whatever evidence was coming through. And we had to have a way of getting that information to staff very quickly. In a nutshell, we needed over 6,000 people to follow directions, sometimes without questioning. And I think that's why sometimes we call it a command and control, because a lot of times we didn't have time for conversation. We needed people to just adapt. All of a sudden, I was forced into that command and control leadership style, and that, I would say, was not comfortable for me whatsoever. It really wasn't my style. Particularly, I didn't know anybody yet, right? So I didn't know any of the team. I didn't know my executive team. In fact, I had met them, you know, right before I had arrived, but didn't really know them. So something that would have to adapt very quickly at a time when it's the last thing you should be doing, right? You don't know anyone yet. You're just getting to know your new job. So very uncomfortable. But the situation called for that. And so that's what a leader needs to adapt to. The direction from the province was interesting. The other thing that's noteworthy is sometimes direction came and evidence came from the science table and various committees, and sometimes it didn't. So sometimes I needed to decide when to hesitate and wait, gather more information, let the Ministry of Health come forward with the directives, or Public Health Ontario, and then when to not wait and just make the best decision with what we had and go. So a really good example of this was visitor restrictions. So very politically charged, right, to suddenly not be allowed to have visitors in a hospital. So the decision took a long time. The ministry had to consider very, very carefully doing that type of thing. And as we waited and as staff were feeling uncomfortable and we knew that we were probably being unsafe with too many people in the building, we did make the decision to increase visitor restrictions before the province made that decision. So sometimes we waited and we had time, and sometimes we just didn't. And that sort of fell to me to kind of decide when we went out on our own versus waiting for ministry direction. Can we go to the next, Allison? So a couple of things. Probably early days, this was the most important thing. Still to this day, it's a huge issue. So, you know, we've asked a lot of our teams during this time, you can imagine, and of course they had concerns for their own well-being and that of their families. But despite that, we needed them to continue to perform their jobs at a high level, provide excellent care to patients, but keep patients and each other safe. My most important role in those early days was to support the safety of staff and physicians, and provide them with the tools they needed to do their jobs effectively. So fly cover for them, have their back, support them, keep them safe. Personal protective equipment supply issues were huge concern, and therefore who got to war, where, what level of protection, in what situation became extremely contentious. So how do we conserve our supply but keep people safe? Who should be wearing N95s? When should they wear them? Did we need face shields at the same time? When did we need face shields? If we overutilized PPE, we would most certainly run out. That was a definite. So it was one of the two things that kept me up at night. This was one of them. There was a global shortage of masks, as you would probably recall. So we had to introduce strict conservation stewardship protocols. They had to be followed to protect a limited supply, but also keep people safe. So extremely stressful times, uncertain. Here's the thing though, as a leader, even though I wasn't sleeping at night and I was worried thinking we would run out, I had to somehow instill confidence in those around me, but also admit that I didn't necessarily have all the answers, right? So there was a careful balance, making sure that people had confidence in us, people trusted us as leaders to make the best decisions for them when we, a lot of the times, didn't have that confidence in ourselves, right? So making sure that you instill the confidence, but you still admit to staff sometimes that you don't have all the answers. I, in those days, relied on something that I've used my entire career. Surround yourself with really smart people and rely on their counsel. So a council of smart people you should always have around you as a leader. And that's really what I relied on. And in the end, you know, I often had to make some hard decisions when there really wasn't consensus what we should be doing. But as long as everyone had their voice heard, people typically would align with the decision and implement the decision, even if we didn't necessarily implement everything that they had recommended or the advice that they had given. So a lot of listening to the experts, but then taking decisive action shortly thereafter. Can you go to the next, Allison? Thank you. Ooh. Thanks. A few things here, you know, building trust. So I've held the opinion that the most critical element of leadership is creating a culture of trust and then having integrity as a leader. This is something that anyone who's ever worked with me or for me would say of me, I would hope. As a new arrival to Niagara Health, I would have established a culture of trust and transparency and built my credibility with staff and physicians over time. But really in this situation, I had no time. So what was I going to do about that? We had to establish trust, but we didn't even know each other. We were spending hours and hours together in crisis, but there was actually no time to get to know each other. No time to learn work styles, no time to create expectations, understand expectations and things like that. My style is typically to assume a high level of competence and best intention unless proven otherwise. So that's, you know, the take that I had on the situation, and I'm pretty direct in my communication style. So about a month in, after trying to figure out what I was going to do about this, I just sat and spent about an hour with the executive team, told them I needed their attention for an hour. I needed them to put down their phones, put down their computers, and we needed to talk. I outlined what type of culture I wanted to create and what I expected of our team, and did that resonate with them? You know, talk to me about it. Could they agree to it in this situation? I specifically talked about trust. I asked them to trust me even though they didn't know me. And frankly, I hadn't earned it. So if they were the type of people that made you earn trust, this was going to be tough. I promised to live up to it if they could trust me, and then in turn to trust them. And we had a very frank conversation about it. And I think that went a long way to actually people take a deep breath and think, okay, we don't know her, but she's honest and open and we can talk to her. I also asked that we openly engage in constructive conflict, share every perspective openly, listen to every opinion. But once a decision is made, we must show a united and strong and confident executive team to the staff. The staff must have confidence in us, even when we don't have confidence in ourselves necessarily all the time. So we openly talked about that. I wanted to make sure people felt safe around me, that they could disagree, tell me that I'm being stupid, tell me that there's other perspectives. We had to have that open conflict, or we were never going to make the best decision possible in the short amount of time that we had. So for me, openly asking the team to buy into a certain culture and then making sure I always maintain those attributes. That was critical. So that way they could start anticipating how I would react or what I might ask of them. And to me, that's sort of a key element of trust in a professional relationship, that someone can count on you to act and behave the same way over time. Those dark days, and there were some dark days, we had to maintain a level of optimism and confidence with the staff while still being genuine and showing vulnerability. So not sugarcoating anything necessarily, but trying to make sure everyone understood, we got this, we're gonna be okay, we're gonna support each other. And in our case during the pandemic, this is, it's extremely important. So great example, the second thing that kept me up at night that I'll share with you was that we needed in wave 1 and then again in wave 3 to decide how we would triage access to critical care services. So if the system became overwhelmed and we came very close, how we would decide who received full critical care services and who didn't. That is not something healthcare providers go to school for, right? It's something that we hope we would never have to deal with, but we did have to make those decisions. So if you think of what trust is necessary amongst a team to know that that's a decision you might have to make, was profound at the time for us. And we also had other dark days, right, where the team had to be cohesive. Treating your own colleague for COVID, someone who you've worked side by side with during the pandemic, all of a sudden being in a bed in the COVID unit. That's something that happened and the team had to deal with. Massive outbreaks and transmission amongst staff. And the blame and conversely support in those situations. So the team really had to believe that we had their best interest and we were also acting in their best interest in every situation. And that's a fundamental element of trust. Just quickly, I'm just checking my time here. A little bit on building relationships. So, given that we were asking a lot of the team and they were making such huge sacrifices, it was important to place additional emphasis on showing appreciation. And that was not easy during the pandemic because we really could not be on the units. We were trying to stay away from each other. We were trying to decrease traffic in the hospital. And I was able to spend lots of time with the executive team and those leaders who were part of that emergency operations committee, but I needed to connect with frontline staff as well. So as each wave passed, with the executive team, we visited the units, we would go to all the sites, we would thank staff and physicians for their work, even just for a few minutes. And that made a big impact on people. We got great feedback on that. Just me getting to know people a little bit, communicating just for a few minutes made a difference. It's also important that I always responded to people who reached out to me, no matter what they were saying or questions they were asking, or whether it was calls or emails or meetings. Getting a response from me directly was very important for me personally. And besides internal relationships, external relationships and partnerships were so important. We would never have gotten through what we were able to accomplish without that. This picture, for those of you who don't recognize it, is the Seymour Hanna vaccination clinic that we opened. So we did have to run a mass vaccination clinic for quite a few months. We could never have done this without partners in public health, the Niagara region, our EMS colleagues, our primary care colleagues, and the city of St. Catharines. So really between waves, when I wasn't completely head down, I did focus to the greatest extent possible on building those external relationships that I really couldn't get to in the early days. And these relationships have been critical to our success since. And then just on communication, I just mentioned it, but in this environment, it goes without saying that clear and consistent communication is crucial. Providing the team with as much information as I possibly could in order to do their work safely. And this is a challenge in any organization of our size, but particularly difficult when the information is changing, sometimes hourly. That's how quickly it was in the early days. So that communication piece was essential. And there were limited opportunities for face-to-face, as I said. So we held bi-weekly virtual town halls for everybody, not just with me, but with the senior team and key members of that emergency operations committee. And it was important for us to answer all questions, have conversation with staff. On the weeks that we weren't doing town halls, I did a video message to staff, and everything was taped so that people could see things on their own time. And then we had regular outreach meetings with senior leadership throughout the organization. We also tried to have that very same sort of methodology externally. So making sure we were available for media, available for the public, transparently posting our data on our website, very committed with a social media presence to informing our community so that the community would have confidence if they did have to go to the hospital, if they did have symptoms, that they would be taken care of, and that they understood also the limitations in what we could and could not do at the hospital. So I'll just end with this last slide. If you could go to the last, Allison, thank you. Silver lining in this whole thing was that my learning was very, very expedited due to the pandemic. I could not be prouder of leading the team I do. I am so blessed to have been their leader during this time. Just tremendous humans. And I know you've all heard about healthcare heroes during the pandemic, but I can tell you, I interact with them every day, and it's been a really remarkable effort in Niagara. Not just the commitment to patients and families, but to each other has been tremendous. This slide is just a summary of things that I think any type of leader needs to remember, but really important when you're leading through a crisis, whatever that might be. Hopefully no more pandemics. I'll mention just 3 of them that really resonate the most with me. So first, inspiring trust and confidence. We talked about that a little bit, but then living up to it. So you've got to live up to it. You've got to walk the talk all the time. And the second being trust your people without hesitation. We didn't have time for me to wonder, ooh, who can I trust? I had to freely give trust unless someone demonstrated that I ought not to have trusted them. And that way people also felt comfortable telling me when I was making a mistake or when I hadn't considered all the options. And so people felt comfortable interacting with me. And then the last I'll just mention there at the bottom, your verbal and nonverbal language is speaking all the time to your team, and they are watching you. So I think being very cognizant of your presence, the words you choose, your demeanor at all times is always important as a leader, but really during a crisis is exponentially more important because it will sort of spark the panic or it will spark the calm. And I'll leave it there, Abdul, and happy to take any questions anyone has.
Thank you very much, Lynn. From personal experience of family members working with the hospital system, and also, you know, everyone that I know have had the opportunity to take vaccines, such a tremendous effort across the board, especially in the hospital system that's gone through, and those that work there from that, you know, the healthcare heroes, many of whom have had the pleasure of speaking with, and in cases working along. They're echoing some of the elements that you're seeing here, that you're speaking to here. Yeah, leadership, trust. The lessons, the traditional lessons of leadership is, especially in a time of crisis, it's about building trust before you need it. But in this case, you didn't have that pleasure. You didn't have that opportunity. You came in, and within days, this was the deep end stuff. How did you go about building those deeper enshrined trust in there? And you did speak to this a little bit, but in this setting, recognizing that it is a pandemic, but it's people's lives. Such a hard decision to make, and such the gravity of that. Did that weigh in this, and how did you work through that?
Yeah, it's a great question. During some of those early days, it was almost easier to somewhat block that out. There was so much that had to be done, and particularly given that I really didn't know people well, that we ended up, you know, taking the directives and implementing to the best of our ability and somewhat blocking out some of the what if scenarios. So what if we run out of PPE? What if we become overwhelmed? What if people arrive in our emergency departments and we can't treat them? We have to, you know, send them elsewhere. Where would we send them? Everyone will be overwhelmed. Some of those questions, although we knew we would eventually have to deal with them at those early days, a little bit of blocking it out so that we could focus on what was in front of us each day. I would say that that was important. I think fundamentally, in a crisis as a leader, sometimes you think, well, I can't show any vulnerability. I have to be the strong one. I have to do it all. I have to have full control, and everyone has to have confidence in me. But actually, I think what helped was showing vulnerability. And as leaders, we all sort of fundamentally know that, but in a crisis, can you really do it? And I really didn't have a choice. I had to. I didn't know how the hospital worked. I didn't know my way around. I barely knew where the bathroom was by the time this thing hit. So I really did have to be vulnerable with staff. And I had to say I didn't know a lot of the time. And I think that helped other people also be vulnerable and admit that they were struggling or they'd had a bad day, checking in with each other. I think a culture of safety in our team was critical. So I had to make sure people felt safe with me no matter what. Tell me if you've made a mistake. Tell me if things didn't go well. And conversely, tell me if I'm making mistakes. So I think if one thing helped, it was, being able to show that vulnerability in and amongst the team, but being careful that the staff who were on the front lines were completely confident that you got it. Like, they didn't have time to worry about what was happening outside the walls. They had to worry about the patients in front of them. So we had to have that nice balance of, instilling confidence in the staff, but being vulnerable with each other such that we could, support one another.
Yeah, those must have been some difficult and hard conversations to have had. What might be your advice for having those hard conversations during a crisis as a new leader?
Yeah, so I would say in any situation, well, first of all, I think as managers and as executives and leaders, having difficult conversations is an extremely important part of our job, and it's easy to avoid them because they're so hard. And I always say to people, that's the hard part of the job that is probably most important. So I think you have to have those hard conversations. And I think it's incumbent on leaders to be forthright and honest in those conversations. We owe it to staff. So I usually start those conversations with acknowledging that this is going to be a difficult or sensitive conversation. So telling people right up front that this is going to be tough, but we need to have the conversation, and it's going to be sensitive. So I usually start that way. But always, no matter how difficult the conversation is, and I did have to have difficult conversations on performance and expectations with people during the pandemic. And they're hard, but always being kind and calm. So no matter what the message is you're delivering, even if it's really hard, the kindness and forgiveness and non-blaming, I think, is critical. So starting out with acknowledging that it's going to be hard, really being forthright and honest, because that's our jobs, we have to be, but making sure that there's always a kindness and support element to the message we're delivering.
Over the time that you've been at Niagara Health and working with the team, which sounds like a quite close-knit team, how have you noticed elements of your leadership passing on, or that culture being built? What were some of the elements that have stood out more than others? Knowing that leaders are under the microscope, as you pointed out as well, others are watching you, looking at you during a crisis, but also not knowing the organization, not knowing the individuals. At the same time, you bring that brave face effectively and keep calm and carry on approach. What have been some of the changes that you have seen over the past months and a little over a year that has resonated quite well, that are still there, and where maybe some of the elements that you would like to work more on?
So two things come to mind that I think have been somewhat stark changes for me that I've noticed. The first would be an environment where it's safe to be vulnerable, make mistakes, have a bad day. I think my sense when I came to Niagara Health was there was a little bit of, I don't know if fear is too strong a word, but people didn't, I would say, feel comfortable saying, oh, I made a mistake, or, oh, I screwed up, or I need help, or I'm not, like, I don't know how to do this. There seemed to be just a, no, everything's fine, everything's good, when it really wasn't. My modeling of behavior to say, well, I screwed up, well, I made a mistake, well, I don't know what to do. Modeling that it's okay to actually say that, do that, make mistakes, and no one's going to beat you up about it. I'm never going to beat you up about it. I mean, don't make the same mistake 10 times. That might be an issue. But in this environment, man, nothing was perfect, nothing. So making sure that people were safe to say, I don't know what I'm doing. And to model that also with their teams. Don't beat people up for making a mistake. I think that would be one thing I've seen a change. And the other would be, you also need to trust your team when you're not there and take care of yourself. So there was a bit of a culture of, well, you went on vacation, but you never really went on vacation. You were still at meetings, you were still, you know, there was no delegation of authority. There seemed to be this authority was there all the time. And we couldn't function like that. People needed time off. And I said, well, you know what? I'm not doing my job if I don't trust you guys to run the hospital when I'm not here, right? I need time off. You need time off. So we have to demonstrate that when I'm not here, you're going to make my decisions for me and you're going to do the best you can. And it may or may not have been the decision I would have made, but that's okay. I'm going to delegate to you and that's it. And then I expected that of them. And I think it changed the way even the directors were feeling eventually in the pandemic. They were safe to be away and trust their teams and take time off for themselves, because I cannot describe to you how exhausted people are. They are exhausted, and we can't run the hospital with like 6,000 exhausted people. So I think actually trusting your team and taking time for yourself has been a change that I have really liked to have seen. The thing I would probably change going forward is much more time spent with individual frontline staff. It has been really difficult to do that. And I really have to get better at not getting mired in the day-to-day mess and taking time to be with staff in a much more open sort of open communication that's not crisis-based, right? Find time that's not crisis-based to engage with staff.
Having time, that's one of the wishes of many leaders, I'm sure. That's bringing the TARDIS or any other time travel device of that nature.
For sure.
And speaking of that time travel, if you were to look back through your career, I'm sure there are many highlights. And we just learned through this time here how successful you've been as a leader here, and as a resident of Niagara, we're so grateful. I'm so grateful for having leaders like yourself and the work that the hospital's done to make this environment and this community safer. But looking back to your career, what have been some of the key elements that have shaped your leadership habits over your career?
Wow, that's such a great question. I've been really fortunate in my career to not sort of proactively seek out, but have been given opportunities where teams were either struggling with success or accountability, or a brand new team that actually had to be structured to deliver on some massive project. I've probably got to transform teams to deliver in a different way, probably 4 or 5 times in my career. So those opportunities really grow you as a leader, there's no question. Some of that at Cancer Care Ontario, my time there, some of that at Toronto Rehab, my time there. Sort of taking a team that's struggling and creating a culture of success and what the elements of that are, I think is something that I'm sort of highlights of my career have been those teams where I've had that opportunity. It's interesting, one of those opportunities and teams was during SARS. Some of my best learnings actually were from SARS, and it was short compared to this, and not as impactful, I would say, but it was one of those team experiences that was really positive for me. It wasn't positive for everybody. So I would say that that's probably the highlights for me, is seeing a team go from sort of mediocrity, fledgling, low performing, to really superb performing, great culture, work hard, but have fun at the same time. Those would be my key highlights.
Fantastic. And perhaps one more question. For those who are watching this live or the recording and with leadership aspirations, what may be some of the lessons that you could have them direct their focus on as they're looking to develop their own leadership style and capabilities?
Yeah, so I think I would say find some leaders that inspire you, either people you know or, maybe some famous leaders that we have the privilege of getting to watch. Find some leaders that really inspire you to sort of model some behavior after. Also find some leaders you don't think are very inspiring. We've all had bad bosses where we've probably learned some of the things we don't want to be as leaders. I think it's really good to learn from both of those situations. So find those people that inspire you. The other thing I would say, and I say this all the time, so this won't surprise people who know me, managing people, being a manager is a privilege. Unless you actually want to spend 95% of your time developing other people, making other people successful, making them better than you, hoping their careers go further than yours, unless that's what you love, you shouldn't be managing people. I think as leaders, we sort of think, okay, well, I've done this for a while, now I should be a manager, then I'm going to be a director, and I'm just going to move up. In fact, leaders, managers, directors, whoever, have hugely profound impact on people. And that can't be taken lightly. So I think leadership has to be about loving, supporting other people. So I would sort of give counsel to people to say, are you sure that's what you want? Because 90% of it's fun, but there's like that 10% of it that is really, really hard, right? Having those tough conversations with people, people not performing, teams that fail. It's not all easy, it's hard work, so you have to really love it. So that's sort of maybe a couple of pieces of advice I would give to people.
Excellent. Thank you so very much, Lynn, for taking time out of your busy schedule, especially today that you're not at work, but still speak to the integrity and keeping your word and coming in, giving your time off and speaking to our audience here. So much appreciate that.
Thank you, Abdul.
Goodman Group is a community-focused learning and development services provider that works to support professionals, businesses, entrepreneurs pursuing growth through professional development certificate programs, executive education, consulting services, and startup support. And there are a number of programs that are available through us. Looking at the time, well, that is all the time that we have for today's Business Breeders session. Thank you all so very much for tuning in to today's session. Joining me during the next session of Business Breeders are Drs. Tek Sangopapanal and Dr. Magnus Holtman, who will be speaking about identifying the best light for and revealing your new product through it. So if you have a new product and you're looking to launch that new product, you might want to tune in to this session that's coming up. And the registration for this is open and live on our website. Well, that is all that we have time for this morning. I hope that you can join us next time. Until then, stay safe.